στα αγγλικά. We will now proceed with a brief panel discussion entitled Shaping the Future, Neurological Advances and Affidea's Strategic Role. And please join me in welcoming on stage three leaders in this journey we're discussing tonight. It's Dr. Charles Niehaus, Executive Director for Affidea Group. Dr. Niehaus has been instrumental in shaping the neuraCare vision, as you have already heard. Professor Politis, once again, please join us on stage, sir. And Yamamura, General Manager, Digital Solutions and Care Pathway Enterprise Solutions from Affidea's strategic partner, GE Healthcare. I hope I said it right, Mr. Yamamura, please. Just to stress that GE Healthcare is a company whose technology and innovation are indeed helping to make this vision come into reality. So we will have to keep it short, but I hope we can cut to the chase. And I'm starting with you, Dr. Niehaus. I would like you to take us a bit behind the scenes. I would like us to go back at the time when you were designing neuraCare, and please share with us which was the specific breakthrough idea that you felt and you believed that could truly change the system. And of course, I would also like you to share with us, how do you see Affidea's role in shaping the future of neurological care?
Well, first of all, thank you very much. Apologies for my Greek capabilities. I'll have to speak English. And these chairs are really comfortable, so I think I'll stay here for the rest of the evening. Look, I think there's been a lot of work done behind the scenes by multiple people and led by Marios, and as he said, acknowledged a lot of people today. But there was a point in about 2.5 years ago, I think we realized that whatever we do, we can't continue to do the care in terms of neurology the way we've done it. Mm-hmm. It was fragmented, it wasn't integrated, and I think patients were demanding a different solution. We've seen it across all the health systems where we operate, across 15 countries. There is just not the ability for a health system to respond. So what we had to do is we had to take a step back and say, well, what would be successful? And I think as most things in medicine happen, we realized quite quickly that we needed to bring a multidisciplinary team together, right? Not just doctors, but allied health professionals. We needed to bring industry partners together to ensure that we have the technology and the necessary aim to do fast and speedy diagnosis. And I think, as all of us probably have been touched by either friends or family that have got this debilitating disease in terms of neurodegenerative things, it's just increasing, as Mario's raised. So we had to do something different. And we did a long and hard search in terms of what could we be doing, etc. One thing we have seen is that health systems can't cope with the growing need of healthcare. The cost is going up, there's a shortage of clinicians, etc. So we all need to work together, and as a team, we've got a better chance. I think that was the first principle. I think the second principle was that we needed to be able to enable our clinicians to have the necessary tools in terms of equipment and the newest technology to actually use what we see on the television in an easy and accessible way. And then I think the third thing that we've realized is that the acute system is under pressure everywhere, and that they really look so well after acute patients. But patients with chronic neurodegenerative diseases need something different. And if you can enable this and move it out of hospital into the community, it's more accessible to patients. If you can give them all the necessary, enabling support, then I think you can make a faster diagnosis. And a faster diagnosis enables people to have confidence in terms of what they need to do. It enables them to manage their families and this disease better. So we're very excited about the opportunity. We are working very hard. We've got lots of proof points across Europe. And what we've done here was to try and really bring it together using the key opinion leaders and making sure that we get the input both from them, the allied health professionals, bringing the multidisciplinary team together with our technology partners, etc., not only in the equipment, but also in new ligands for isotopes. It's moving so fast, and we need to be able to respond to it. So we believe by doing this, we will be able to move things forward quite quickly and help patients.
Fingers crossed, because you have, as you said, we cannot underline enough the importance of neurological care, not only for the patients, but also for their families and therefore for the whole community at the end of the day. Now, Mr. Yamamura, Dr. Yamamura, GE Healthcare is a strategic partner in this whole project, in this initiative. I would like you to share with us what excites you most in this collaboration.
Yes, so first of all, thank you for having me here. And well, this project is really exciting for GE, not only because we have a good partnership with Affidea, but also from a clinical point of view. So if we talk neurology in GE, probably most of the people would think, okay, they have the equipment like PET-CT we have or MRI, but we are more than that. Especially in these days, healthcare is digital health. And in digital, we also have so many tools that we can share, that we can use to optimize the healthcare for the patients. So we have the MIM software, which is doing automation of PET-CT scan and everything. And on the other hand, what excites me more, because I'm an academic radiologist by my background, and what really excites me is, so in GE, we have a study going on at this moment where we are the industrial lead for Alzheimer's. But this study is, formed with a lot of cross European countries, but only with academic institutes. Now we have the chance to do kind of the study also with the private sector, and this is the future of medicine in my point of view. And this is me talking as an academic radiologist, because I saw a phrase here, bringing science to the public or to the people. And this is not in the future coming from an academic only. It's not going to be. Because like I said, the healthcare at this time is more digital. And you don't have to be a mathematician to see where the bigger data is, in Affidea or in university hospitals. It's 15 countries. Of course, that's more data in Affidea. So I think this partnership is really exciting, because we now really can push the healthcare into the public sector, into the people. And this is really exciting for us as GE as well.
Well, thank you for sharing that, Mr. Yamamura. I'm tempted to ask you what we should expect at the time of AI revolution, but we really don't have the time. Mr. Politis, we've spoken and you stressed the importance of clinical research, and I would like you to share with us the expectations you have. I mean, how do you believe that it will redefine standards of care?
Yeah. Thank you for this. I think we have reached the point where our vision is reforming about how we can reshape the approach to the healthcare going forward. So the modernized concept of how we see things pushing beyond the standard of care nowadays is about creating the ability of having different forms of the healthcare sector working together. So today, I think, is one of the biggest testaments around this concept. We have like the Minister of Health from the government, the University of Athens, and a private healthcare provider, all at the same place, serving the same goal. So that type of collaboration brings also research in a very prominent role. And why is that prominent role? The reason is first because the ability to provide to the patients the possibility of participating in research gives them the opportunity to get something before it's time to be tested. Secondly, if that aspect could be something promising, you can translate very quickly on the clinical management, because typically the research side with the clinical implementation side, they have a big lag in terms of the time. So what we're trying to do here by connecting all these dots is minimize this time as much as possible so we can implement the promise to the patients. So neurocare should be like a fantastic platform to be able to do that. And one of the reasons that we have such a tremendous group of doctors, which we are absolutely privileged to have part of all this project, and hopefully we will be able to repeat that in the other countries, is to create these hubs on the cities and then try to connect them together so they operate as one unit, and then having collaborations with the biggest university locally, as we're doing here with the University of Athens.
So you're describing a network that could...
We're describing almost like a net that will go around Europe to try to bring the biggest possible level of excellence so everybody could benefit from the knowledge between the different places.
Right.
It's about accelerating, pushing like further and further and further.
And with the patient at the forefront of this effort.
Absolutely.
That's amazing. Thank you, Mr. Politis. Just to wrap it up, I would like to ask, it's a common question, basically, if you could pick the impact that you believe that would be the most important. We've discussed today in many levels, the community, the patients, science, the academy. What would you say, Dr. Niehaus?
Well, I would argue that patients will get faster, and that's very important in these diseases, accurate diagnosis. I think clinicians and doctors will be able to work together in a collaborative way rather than in silos, supported by the necessary technology, etc., in the right place. And that's very important. And then I think health systems will have better patient outcomes, which why we treat patients, and then at a lower cost, ultimately. So.
Thank you, Dr. Niehaus. Dr. Yamamura?
So,
from a technological point of view, I guess.
Well, I think this is can be the start of globalization of healthcare, and this is really the next chapter for radiology as well, in my opinion, right? Because we have to give the people the possibility to get diagnosed, get the best treatment, and this could be, the beginning of globalization. I mean, Affidea is a big player, so if we can use this knowledge, the digitalization strategy. At this moment, I think one doctor can maybe see 40 patients a day, max. By using digitalization, using AI in such a big group, we can leverage from 1 to 40 to 1 to eternity, basically. And this is the vision that I have, and this is probably the vision that also Affidea has.
Thank you, Dr. Yamamura. Kyrie Politi?
Yeah, for me, I agree with all predecessors, but for me, it's always like the patient in the middle. So everything we're trying to do is about how we can serve that better. And I go back to something that we've said like a couple of times already. It's all about a team. When we're working together, when we bring like the expertise from different angles, and we can be able to approach that in the most holistic way possible, it's always going to benefit the patient. It's more privilege for them, more possibility, more opportunity, and more solutions for the problems which are complex in this occasion.
I would like to thank you all. Thank you so much for this discussion. Να ευχαριστήσουμε τον Dr. Niehaus, τον Dr. Yamamura.